Hello, this is Dr. Todd Rozen from the Mayo Clinic in Florida, and I'm going to be talking to you today on atypical headache syndromes. We'll do this as case-based presentations. We will be using the ICHD or International Headache Classification criteria, which have been put together by headache specialists to define headache disorders, so to allow everyone to be speaking about the same condition. So, our first case. I have a 67-year-old man for the last 6 months has been complaining of severe head pain every time he coughs or strains. The pain is typically bilateral frontotemporal region, although he can also feel it at his vertex. The pain is described as a sharp sensation, typically lasting 2 to 5 minutes in duration. Over time, he has now almost recognized a low-grade persistent daily pain in between the severe pains. He has no previous headache history. His neurologic examination is normal, except for some mild greater occipital nerve tenderness bilaterally. A previous physician was concerned that he may have meningitis, so a lumbar puncture was completed, which was normal. He also brings normal neuroimaging. He was told with a spinal tap his opening pressure was normal and he had no relief. So this is a description of cough headache or primary cough headache, as long as you rule out secondary disorders. And cough headache is defined by a headache precipitated by coughing or other Valsalva maneuvers, so short bursts of Valsalva, but not prolonged physical exercise. Typical duration is short. It can last 1 second to 2 hours, and the temporal profile of onset can be very sudden, almost thunderclap-like. It's rare. For all headache disorders in the clinic, it's about only 1%. So again, a primary cough headache arises moments after the cough, reaches its peak almost immediately, and then subsides typically over several seconds to a few minutes. It's typically bilateral and posterior, and one of the take-home points is it's a disorder of older individuals, typically says 40 here, but typically age 50 or up. First described by Tinnell in 1932, first recognized as a benign syndrome by Simmons in 1957.